Welcome to the bleeding control section. In this lesson, we will use 3 medical supplies, gauze dressings, bandages, and a tourniquet. Before starting, wear gloves if available. This protects both you and the casualty from infection. Step 1. First, gauze dressing. It is a soft, sterile pad placed directly on the wound. It absorbs blood, protects from dirt and infection, and helps healing. Step 2. Open the package, place the gauze directly on the bleeding wound, and apply firm pressure to stop the bleeding. Step 3. Bandages secure the gauze, support the injury, and maintain pressure. Types include adhesive, elastic, and roller bandages. Wrap the bandage over the gauze to hold it in place and protect the wound. Step 4. If bleeding does not stop, apply a tourniquet. Use it only for severe bleeding or limb injuries when pressure is not enough. Place the tourniquet 2 to 3 inches above the wound, between the wound and the heart. Avoid joints or placing it directly on the wound. Tighten until bleeding stops. Mark the time you applied it. Do not loosen or remove the tourniquet, only medical professionals should do that. Welcome to the primary survey and CPR section. In this section, we will introduce the DRSABCD primary survey and CPR. D. Danger. Check for any danger to yourself, the casualty, and others. Make sure it is safe before you approach. R. Response. Check if the person is responsive. While checking the casualty's response, you assess their level of consciousness using the ACVPU scale.
Hey, are you okay? What's your name?
S. Send for help. Call emergency services immediately or ask someone to call. A. Airway. Open the airway by tilting the head back and lifting the chin. Check for any visible blockages and remove if safe. B. Breathing. Look, listen, and feel for normal breathing for 10 seconds. If breathing, place the person in the recovery position. If not breathing, start CPR. C. CPR. If the casualty is unresponsive and not breathing, begin CPR immediately. We will explain CPR in detail next. D. Defibrillation. Use an AED if available. Follow the device instructions until help arrives. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Begin CPR. Let's begin CPR. Step 1. Chest compressions. Place your hands in the center of the chest. Push down hard and fast, at least 5 to 6 centimeters deep. Perform 100 to 120 compressions per minute, about 2 compressions per second. Allow the chest. Step 2. Rescue breaths, if trained. After 30 compressions, give 2 rescue breaths. Tilt the head back, lift the chin, pinch the nose, and breathe into the mouth until the chest rises. If you are not trained or unwilling to give rescue breaths, Step 3. Continue CPR. Repeat the cycle of chest compressions and rescue breaths until help arrives, an AED is ready, or the casualty starts breathing. Welcome to the choking section. In this part, we will guide you on how to respond to a choking emergency. Step 1. Assess the situation. Approach safely and check if the person is truly choking. Ask, "Are you choking?" Step 2. Call for emergency help. Call emergency services or ask someone nearby to call immediately. Step 3. Give back blows. Stand to the side and slightly behind the person. Support their chest with one hand and lean them forward. Use the heel of your other hand to deliver 5 firm back blows between the shoulder blades. After each back blow, check if the blockage is cleared. Step 4. Perform abdominal thrusts, Heimlich maneuver. If the object is not cleared, stand behind the person. Place your arms around their waist. Make a fist with one hand and place it just above the belly button. Grasp your fist with your other hand. Pull sharply inward and upward. Perform up to 5 abdominal thrusts. Step 5. Repeat the cycle. It's your turn to continue alternating 5 back blows. And 5 abdominal thrusts until the object is expelled, the person starts breathing or coughing, or the person becomes unresponsive. The patient is unresponsive. Start CPR immediately. Continue until help arrives. Step 6. If the person becomes unresponsive, start CPR immediately. Begin chest compressions and check the airway for the blockage before giving rescue breaths. Continue. Well done! You have completed the choking first aid training. Congratulations on completing the first aid training. In an emergency, every second matters. Your knowledge and actions can save lives. Keep practicing the skills you've learned, and approach every situation with calmness and confidence. Thank you for your dedication. We trust you will use your training to make a real difference.